Welcome back. Here are all the hormones that you'll have to study for your Step 1 exam. We'll have a separate video for each hormone, but today we'll talk about aldosterone. We get aldosterone from zona glomerulosa and the adrenal cortex. Aldosterone reabsorbs sodium and expels potassium. And remember, wherever sodium goes, water will follow. It basically decreases water in the urine and increases water in the plasma. Think of it as a reverse P. We see excessive aldosterone in Conn syndrome and deficient aldosterone in Addison disease. These are the main two diseases related to aldosterone. In elevated aldosterone levels, we're going to have water retention, which will cause hypervolemia, and that results in hypertension and eventually heart failure. Look for increased sodium levels and decreased potassium levels. Hyperaldosteronism can either be primary, which is called Conn syndrome, or secondary. In all endocrine disorders, whenever we say primary, we refer to the part of the body that secretes the hormone. In this case, the adrenal gland. So look for adenomas and hyperplasia of the adrenal gland. And secondary hyperaldosteronism refers to a problem outside the adrenal gland that eventually resulted in high aldosterone levels. For example, renin can control aldosterone levels, so if we have high renin levels, we're going to have high aldosterone levels. And this is secondary hyperaldosteronism. Deficient aldosterone levels result in salt wasting and potassium increased in the blood. Patients will have salt craving and dehydration, and they will eventually develop hypotension. So in labs of hypoaldosteronism, look for decreased sodium levels and increased potassium levels. And again, the causes of hypoaldosteronism can either be primary or secondary. Primary refers to problems in the adrenal gland, and we call this Addison disease, which is caused by bilateral destruction of the adrenal glands due to autoimmune diseases. And secondary can be caused by electrolyte disturbance. And here's a small quiz for you. So, how does Addison disease cause skin hyperpigmentation? Because Addison disease results in destruction of both adrenal glands, we're going to have drop levels of both cortisol and aldosterone. Decreased levels of cortisol will trigger ACTH from the anterior pituitary gland to stimulate more cortisol secretion. And the elevated levels of ACTH will eventually break to melanocyte stimulating hormone, which will cause hyperpigmentation. So it's really the decreased levels of cortisol that cause the hyperpigmentation, not aldosterone. Anyway, that's all I have. Thank you so much for watching, and I'll see you guys later.